Hi, Jennifer. Welcome to the Genetic Genius podcast. I'm so excited to have you as a guest today.
Thank you so much for having me. I'm excited to be here.
Yay! So, first of all, let's just can you talk about your story to the listeners about who you are, what you do, a little bit about your practice, and then we'll dive deep into the show.
Sure. So, my name is Jennifer Brand. I'm a clinical nutritionist. I'm a certified nutrition specialist. I have been in private practice for going on 4 years now, full time, private practice about 4 years. And I specialize in childhood skin rashes, so eczema in particular, as well as food allergies, food sensitivities, and gut problems.
Mm-hmm.
I'm based in Los Angeles and I work 100% virtually, as many of us do now. I've always worked virtually and I love working with families and children and helping them feel better.
That's so great. I love that. And are you doing okay in LA now with the COVID? Are things a little bit better?
I don't know if they're better yet. Just, go outside with my mask on and follow the instructions as best we know.
Right.
Every day is a little bit different. So, yep.
Right. Day
Yep.
by day, I think that's all where we're in now, which is a good place to be, being in the present moment.
Absolutely. Absolutely. Mhm.
So I really love that you specialize in eczema, especially with children. It's such a big aspect of the health of children, and with many people suffer from skin conditions. So I can't wait to learn about your expertise in this particular subject. And we're going to be talking about eczema and food allergies and gut problems, which is a perfect topic, I think, for the new year because so many people are looking at themselves and a way to reset.
Yes, absolutely. And I think too, now that parents are at home more often with their children, they're noticing more. They're noticing the
Hmm.
connections. They're seeing the rashes. They're seeing the allergies happen. I think there's been more of a need and a push for parents to really want to help their children during this time.
Yeah, that's so true. People are spending a lot more time than they had been in the past with their children. And hopefully they're changing things with their food plan and nutrition plan, which we'll talk about today too. So in regards to eczema, can you talk about to our listeners, like what is eczema? Because I think that people sometimes don't even understand what that is by itself.
So eczema is clinically in conventional world known as atopic dermatitis. There are a combination of factors that lead up to its development. It's really believed that there are genetic factors that play a role, environmental triggers, and of course the hygiene hypothesis, which children nowadays exposed to things like antibiotics, and a lot
Hmm.
of these are born C-section, and so they are not inoculated with the microbiomes, which are the healthy bacteria that we need, not just in our gut but on our skin as well. So not getting inoculated with those healthy bacteria, and those bacteria are protective. They communicate with the gut, communicates with the skin. All of the microbes on the skin and in the gut communicate with the immune system. So when we have imbalances there, we can end up with immune dysfunction, allergic conditions, and certainly skin rashes like eczema.
Yeah, so great. It sounds like there's a lot of different aspects or triggers or root causes, which we're going to be really diving deep in today. And that was a great explanation for people to kind of understand because, there's so many different skin conditions. When I studied dermatology, I was like, the book was like, like 3 inches thick. So it's really great to have that kind of defined. And can you explain some of the like root causes of eczema? Because I think that's a great place for us to dive into today.
The primary root cause of the problem that I see in little ones. So, of course, when we're talking about eczema, it's commonly associated with food allergies, food sensitivities. And so, we blame food, we blame things in the environment, whatever it is. These are really triggers. They're not root causes of the problem. When we're looking at the root cause of the problem, and again, especially in little ones, what I see helps the most is working in the gut microbiome, identifying imbalances there and resolving those. Um,
Mm-hmm.
what is happening when we have imbalances in the gut microbiome, that inflammation can develop in there. That inflammation can affect the lining of the gut, which is really thin. It's like one cell layer thick. And so when we
Mm-hmm.
have that inflammation, that's when, the cells held together we get this sort of situation. And so this hyperpermeability or leaky gut. So when that happens, we can get food particles, which get out into the bloodstream, and those can start to trigger your IgE and IgG food sensitivity type reactions. And the other thing too is that it's not just food particles that are getting into the bloodstream from the gut, for example, it's also toxins from bacteria in there. So, and when we eat in general, that creates more die off of gut bugs. So we get more toxins. So it's that leaky gut and that gut inflammation and those gut imbalances that are creating a situation which allows these foreign things to get into the bloodstream, to which the immune system starts reacting, and depends on the person, but that can result in skin rashes in a lot of folks.
So it sounds like it's a lot about the gut, which is, the gut is a mirror of our skin, right? Or our skin is a mirror of the gut. And so it sounds like a lot of dysfunction, that root cause comes from the gut. So what are some of the specific then triggers? You mentioned a little bit about food, which we'll dive into. So what are some of those triggers, and are the triggers like typically part of the root cause? Are they connected, or does it is one causes the other?
It's interesting because I get asked that question a lot. It's like, so what's happening in the guts of these little ones that they have skin rashes? And so typically, well, I can't even say typically, I see different things all the time. So, as a root cause, I have seen in 100% of my clients with skin rashes, I do a comprehensive digestive stool test in everyone that has skin rashes, and every single one of those clients has had imbalances in their gut microbiome.
Mm-hmm.
So those imbalances can be any number of things, and they're different in everybody. So the kind of testing that we look at, we want to see the makeup of the normal gut bugs in there. So those are commensals, like they're there. And if they're in balance, they help keep us healthy. If they're not in balance, we can end up not so healthy. So
Totally.
yeah, so like, so what is that balance? Is it too high? Is it too low? We get to see if there are things in there that we really don't want in there at all. Maybe certain parasites, viruses, or pathogenic bacteria. We also
Mm-hmm.
get to see if the gut immune function, 80%, up to 80% of our immune system's located in our gut microbiome. And
Mm-hmm.
so, we get to see if that immune function is heightened. So maybe something is currently triggering, or if it's depressed, maybe it's been triggered for a while and it's finally kind of, petering out. It needs a little assistance. We also get to see what digestion and absorption looks like in there. So these are the types of things that we're looking at to see what's happening in the gut. And again, I don't see all of those things in everybody, but some combination of factors,
Mm-hmm.
and those imbalances cause that type of inflammation and an inability of the gut to function appropriately, which then affects how the immune system functions. And then you get that downstream, allergic type conditions like eczema, as well as food allergies. Um, in terms of the triggers, again, this is really different for everybody. Sometimes, and by the time people find me, they've tried to take the common food allergens out of the diet, and that
Right.
hasn't solved the problem. Yeah. So, and taking more and more foods out of the diet isn't the answer. Sometimes we go down that path because it's like you take a food out, things get a little bit better, but then they flare again. So now you're blaming another food. So you take
Mm-hmm.
that out. So it's that vicious cycle where the diet gets smaller and smaller. So food can be a
Right.
trigger. Yeah. So food can really be a trigger, but then we've got to back up. It's like, well, why is it triggering? Because of gut problems. Environmental triggers can be problematic as well. Those are more tricky because it's not like we can necessarily chop down all the trees outside of where we live, or,
Right.
change the grass or the foliage. So environmental allergies can be challenging. And there are a lot of children too, and people in general that are triggered by mold.
Mm-hmm.
A lot of, and one thing to look for if somebody is flaring or a child's flaring more at home, but you notice like when you're out somewhere else or somebody else's house, or staying elsewhere, things aren't as bad and things start to calm down. That's when you might want to start looking at what's happening in your home environment, for example.
Yeah. Oh, that's so great. That was such great information. One thing I wanted to back up on is when you mentioned parasites, because it's so, people always, when I'm doing an intake, they always I'll talk about the stool test and parasites, and they say, oh, I've never done any traveling, outside of the country or anything like that. I'm like, well, that's not always the case. And I'd love for you to touch a little bit about that, because I think that's an important key component of the stool testing is the parasites that a lot of people have no clue that that could be causing their skin condition.
Absolutely. And it doesn't matter, if you've traveled or not. Little kids are notorious, right, for playing in the dirt, doing things and putting their hands in their mouth. So, it's easy for children to end up with worms or parasites or something of that nature.
Mhm.
Something else that's a good subject, and I want to touch on this too. I feel like currently it's very popular that people think they have a parasite or a parasitic infection, or they want to do a parasite cleanse. Don't do anything without doing the testing to see what you have.
Exactly.
Yeah, that's really important because I have seen things get worse when people use things that are not appropriate for what's actually happening inside. Uh,
Right.
yeah, that's it too. And parasites are interesting because there's some of them that can cause symptoms and health problems. Other ones are expected to be benign. Uh,
Hmm.
so it just depends. The type of comprehensive digestive stool test that I like to use looks for a variety of them.
Hmm.
And also too, it's not like we can say, when we're looking at test results like this. So let's say we get a stool test back and there's a couple different parasite findings, some, high levels of bacteria, some other imbalances in there. It's not like we can pick out one of the imbalances and say, this is the one we need to address to solve the problem.
Right. Yeah.
We need to take a look at everything holistically,
Mm.
address all of those imbalances and really do a comprehensive plan. And I think that's why, a lot of folks, struggle longer than they need to because
Mm.
you try a probiotic alone because probiotics are good for the gut, or maybe you try a probiotic and glutamine to heal your gut, or you're drinking a lot of bone broth or something, and that's not solving the problem because you really need to take care of all of the steps that are involved and really see what's happening in there.
Yeah, that's so true. It's not just one thing, right? The magic pill, as a lot of, unfortunately, the conventional aspect of things with chronic health conditions, it's like they're here, take this, everything will be better. But as we know, as functional medicine practitioners, that doesn't address the root cause of it at all.
Does not work that way.
No, and it can sometimes make it worse.
Absolutely, absolutely. Mhm.
So one thing you did mention was common food allergens, and I'd love for you to talk about just the kind of like basic ones that people, because there's a lot of testing that can be done to test for common food allergens, which you mentioned. But what are like the top 10 allergens that most people see in relationship to chronic skin conditions?
Well, some of the major ones, of course, that we hear about are like the wheat or gluten, dairy, eggs, soy, nuts, so peanuts, tree nuts,
Hmm.
fish and shellfish. Those are some of the most common ones. And it's interesting because the reason, and so you might be thinking, or at least I think of these things. I don't know if other, but it's like, what do these things, like, what do these different types of foods have in common? Because, like,
Mm,
eggs and peanuts, like, what's
right.
the,
Yeah.
what,
We don't have like an egg and peanut tree.
right? It's like, what do these things have in common? So the proteins in these different foods, and so when we react to something, when we're having an allergic reaction, we are reacting. The immune system is recognizing and reacting to a protein from that food. So
Hmm.
the proteins in those common allergenic foods are poorly degraded in the gut. They don't get broken
Mm.
down well during digestion. So when we have gut hyperpermeability, they're able to escape into the bloodstream, and the immune system over time starts to recognize them.
Mhm.
So that is a mechanism of how those foods become allergenic. There's also the non-oral route where And this is particularly the case in people that have like a disrupted skin barrier, like with eczema, we have a disrupted skin barrier, disrupted skin
Hmm.
barrier function. So in people that have that, they can actually be sensitized through the skin. So exposure to touching these foods and having these foods, on them, near them, can actually result in that loss of oral tolerance.
Right. Yeah, that's so key. When we're thinking about autoimmune chronic diseases like celiac, I always mention to patients you have to remove everything from your house, because even if you use the same knife that went into the peanut butter or the gluten-free, if you're an item that had gluten in it, not peanut butter. I don't know why I said peanut butter, but you know what I mean. If you're using the same knife to chop bread, is what I meant to say, but then and you use it that your partner use, you can still have the same reaction, and so that can be, as a great point, you can still have set things in your home environment that might be, you might not think that you're having a reaction to.
I have two really good gluten stories
Oh,
about
yay.
that. Yeah. And so gluten is one of those things too that it does contribute to leaky gut, to gut hyperpermeability. So
Hmm.
and there's no nutritional value to gluten in and of itself. There are plenty of other healthy grains that, people can eat. So gluten is one of the things that I just say, keep it out of the diet. I don't say that about many things, so we can get into that too. I'm a nutritionist that doesn't really believe in restricted diets. Like I
Yeah,
get people to eat more foods. We
that's
need that.
right.
So with the gluten, it was actually a few weeks back, and two clients I was meeting with going over their stool test results. We just got the results. The testing that I like to use also looks for anti-gliadin antibodies. So it'll show
Hmm.
us if the body's reacting to gluten or not. So one, it was a woman, and she, skin issues and lots of autoimmunity. And so going over her stool test results and her anti-gliadin, so her exposure to gluten, it was showing very high on the test.
Hmm.
So we talked about it. She's been gluten free for years because
Mm.
she knows. And so we were just going over things, and I started questioning. Turns out it's definitely in the house. She bakes very regularly for her children, regular baked goods, and has her hands in dough all the time.
Wow.
So that was where we could gather that this was likely coming from. And then another client was actually that same day. I was talking to somebody else, same thing, high levels of the anti-gliadin in his test results. And again, also somebody who's been gluten free for a long time on an AIP diet, for a long time.
Hmm.
And, we started going through with him what it possibly could be. And so, I asked, is there other people that you're living with? He's like, oh yeah, they eat everything. So, so he's in the house with so gluten is one of those in particular that can really affect people uh
Hmm.
pretty harshly, even if they're not eating it. It's something it's tricky one. Mhm.
Yeah, I know. It's really amazing how, and we don't think about it, especially when we're living with our loved ones or friends and family and eating in a different way. Especially now, I think that more people have been at home. Maybe they're more aware now what's going on in their home environment for sure. Um, and talking about like specific autoimmune diseases, it sounds like there's a connection between skin conditions and like celiac and other chronic autoimmune diseases. Is that correct?
Yeah, there is. And there's more and more research, findings that people with autoimmune conditions, once somebody has an autoimmune condition, they're more likely to get others. So, I do see multiple people that most of my clients are children. So at this stage, we're just dealing with, single issues
Right. Yeah.
across that
Right.
age.
Right. Hopefully they haven't had an autoimmune disease develop yet.
So what happens is it's that hyperpermeability and the imbalances of the gut that lead to autoimmunity over time, because the body again loses its ability to regulate immune function. And
Hmm.
so the body starts attacking different things that it really shouldn't supposed to, isn't supposed to attack, including like the food particles and, other organ systems and other cells in the body. So yeah,
Yeah.
yeah, there is a connection between autoimmunity and what's happening with the skin. Absolutely. It's a similar
Yeah.
process as what's happening in the gut. Mhm.
Totally. It makes total sense, especially when we're thinking about the gut, as you mentioned, like the gut, the main immune system of the gut. Of course, we're going to see reflections of the immune system impacted. totally makes sense. And so we're talking about the gut, and then so the gut dysfunction sounds like it's really connected to skin rashes, not just eczema, but other conditions. And I'd love for you to talk about the gut microbiome, which you mentioned earlier. And can you describe a little bit, like it's such a I don't know, a word that's just thrown around, but in some aspects it is, oh, the microbiome this, the microbiome that. But then I think a lot of people like miss the main actual like point of what the microbiome is.
Sure. Yeah. And it's a very good question. So when we're talking about, so microbiome just refers to like bacteria, fungi, protozoa, viruses, and gut microbiome refers to, all of those things, as well as the genetic material that they produce that live like outside on, in the digestive tract. And
Hmm.
the gut microbiome, I mean, it's really evolved along with us as the host for thousands of years, and it's extensively involved in essential activities that our bodies carry out, like digestion, nutrition. These bugs do help us digest and absorb food. I'll give you a good example of that. They are involved in producing some nutrients in a lot of cases.
Hmm.
Involved The gut microbiome is involved in detoxification, again, the immune system. So it really influences our health or the development of disease.
Right.
uh, and there's so much scientific evidence that's coming out, more recently, at least in the last, handful of years or so, that the gut microbiome in particular really contributes to function and dysfunction of other organ systems, including the skin.
Hmm.
And so one way that the gut microbiome and those bacteria play a really important role in immunity and skin health is, so short chain fatty acids are made by good gut bugs when they ferment dietary fiber. So like when we eat fiber, this is why it's really important for gut health, for skin health, for immunity, that we actually do eat some starchy foods. So prebiotic foods, complex carbs. So, quinoa, sweet potatoes, other starchy, non-starchy vegetables.
Hmm.
What happens is our good gut bugs eat these things. They make short chain fatty acids, and then short chain fatty acids actually help modulate inflammatory responses from the immune system. So they're essentially anti-inflammatory. They
Hmm.
also communicate with the skin microbiome, so all the bugs that live on our skin. So that's just an example of why we need to eat, some of those nutrients and what those bugs actually help us do. So, when there is gut dysfunction or, for example, lower levels of short chain fatty acids are found in people that struggle with skin rashes like eczema. So, yeah. And so when we have imbalances in what's happening in the gut, so maybe again, high levels of things that maybe they're good, but too high, too low, or things we don't want in there at all. This is what we refer to as gut dysbiosis. So it's just
Hmm.
unbalanced bacteria, unbalanced microbes, and it results in abnormal immune reactions. Um, and so, yeah, so when we have that dysbiotic gut environment, it's like that gut skin access. So it can actually lead to eczema as well as psoriasis, and it's acne and rosacea. So gut
Hmm.
imbalances can be root causes for all types of skin rashes.
Yeah. Oh, that's so fascinating. That was a great explanation. And it's so true how, there's so many different aspects of the gut that I think one we're learning about, like you said, in the past couple of years. And then of course there's so much that we don't understand yet because it's such a fascinating aspect of our body that is complicated, but yet simple.
And one of the things that I find most interesting about it, well, of course, my history is a history of gut issues. So I've always kind of been interested in gut. And then I have family history of skin rashes, skin issues, things like that. But one of the things that I really find so fascinating, especially working with little ones, so by 2 years of age and up, the gut microbiome is mature. Before
Hmm.
2 years of age, there isn't really a lot of research on what it's supposed to look like in there. Uh,
Hmm.
but we know that it's messy. Some things like there's some research that says, we expect to see a higher relative abundance of some bugs in there. There's other things I've seen that don't say that. So it is really interesting to work with, and I work with a lot of little ones under 2 years of age. And so when we do the comprehensive digestive stool test, what we're really looking for in there are things that like I wouldn't expect to see, like bugs that we wouldn't want in there at all,
Mm-hmm.
problems with digestion and absorption, or if, and I wouldn't necessarily expect too many bugs to be low at that age, so we kind of have to take into consideration what's happening with the little one, as well as what the findings are on the test. But yeah, it really is an interesting area of research for sure. And there are more and more studies that have been coming out, just really linking not just skin rashes like eczema or psoriasis, but also food allergies, to what's happening in the gut, as well as other atopic conditions like asthma.
Mm-hmm. Yeah, totally. And an interesting component of that, what I hear a lot with patients that when they have a gut dysfunction is they have a brain dysfunction. It's like brain fog. And it totally makes sense because the gut microbiome is connected to our brain and how our brain functions. We have so much communication with the gut and the brain. And so, when I talk to patients about, yeah, your microbiome is so key to your brain health, they're like, huh? How does that work?
And it's interesting because a lot of the folks, right, and a lot of kiddos that I work with also, there might be some behavioral issues, some mood issues. And when we start working on what's happening in the gut, those things improve as well. And one of the other interesting things I find about, focusing on the gut is that somebody might not have any gut symptoms at all, right? Like they might have behavior or mood issues or brain fog or rashes or allergies, but they're pooping regularly, which is once a day, by the way. We want elimination daily is really important for detoxification. If you're not going at least once a day, that really is constipation. But anyway, so there's just so much more to what's happening in there, that people might not really have any symptoms. So it's
Mm-hmm.
helping people understand those connections, like the gut brain axis, like you mentioned, the gut skin axis. So yeah, the gut is really connected to pretty much, I think, every organ system, isn't it?
Right. Yeah, I think so. I think you're right. Totally. Yeah. And I think that there's this I don't know, this aha moment when you're talking about the gut and the connection to the skin. I think people just don't always think about that connection, and they think, oh, I can eat something and it has some kind of effect on my body. But I think that disconnect is becoming more of a connection with people because they're realizing how important, as you were talking about nutrition, how important the component of what we eat affects us. But it also has to do with as you're saying, is the actual function. How's the function of the gut? And that's even more important, as you were saying as well.
Yeah, absolutely. And the other thing to keep in mind too, and I see this often, and again, like most of the people that come to see me, by the time they've come to see me, they're already on these like elimination diets, restricted diets. I mean, they're eating nothing that should be triggering. Like nothing
Hmm.
they're eating should be triggering, but they're still, having all of these reactions. So, it's important to remember that the body runs off of nutrients from foods we eat. When they're missing, we get imbalances, and over time, symptoms and health problems develop from those imbalances. And I really have seen the longer somebody is on a restricted diet, the worse their health tends to become.
Hmm.
And because it doesn't happen overnight, people don't necessarily connect the fact that they're getting sicker to their increasingly limited diet. Um,
Right.
so, and especially in children, it's just, we need to make sure that not only do we get nourished, children are nourished. And, in particular, nursing mothers. I work with a lot of moms that are nursing. The baby reacts to every feeding. Mom is eating essentially nothing.
Mm.
And at that stage, it's like, it's not the food. Mom, you need to eat because now mom is starving and starting to
Right.
come. So it really is important to eat, eat foods for healthy skin, eat foods to nourish our body. But that said, if you don't address the root cause of the problem, those foods will continue, even otherwise healthy, whole, real foods are going to continue to cause symptoms. And as well, when we have issues and imbalances in the gut and problems with digestion and absorption, we could be on the perfect diet, like like if I could put people in a bubble and feed them, right? Like here's what they eat,
Right.
but can't digest and absorb nutrients from those foods, it's not going to matter much.
Right. Yeah, exactly. That's so key. I love some of those points that you're saying. One, elimination diet. And I love for us to go back and talk about that too, because that's, I think, really key. And then two, it's amazing when people come in and they're not eating anything. I see patients with like that too. It's like, well, that can't be fun for you. How is that fun? And they're totally miserable, and bringing foods back in that could bring joy to their life. I think sometimes I see that more of a change than anything else that I do. It's like, okay, let's see how you do when you eat this. And it is important, like you said, that you can be having those same reactions to foods, but if you don't go in there and work on healing the gut, restoring the gut, figuring out that root cause, no matter what you eat, you're not going to get the nutrients from it. You could be eating a candy bar all day, which I'm not saying that's what I want you to do. That's not a good candy bar. Is not a good diet.
No, it's not, but it's totally so. And the other thing too, I find that i- i- a lot of times, with the really little ones, and it's scary for mom to introduce these foods because
Mm,
everything seems to make baby flare, and then
mhm.
it's scary to try to introduce those foods, and so
Right.
otherwise healthy foods. And so that is something, I work with parents on and just kind of coaching them through. It'll be okay. The worst that's going
Right.
to happen, there might be a flare, but it's okay. And so it is interesting because typically when, people start reintroducing those foods, they're fine.
Right. Yeah, the
It's
fear
not
factor gets developed, I think, in that stage when people have eliminated every single possible thing that could trigger them, and then they're like even afraid to eat anything. Then that does not cause a good stress balance, which I think is a great segue to talk about how stress affects the microbiome, the gut, and the skin. And I'd love for you to talk about that as well. But first, if we could backtrack to the elimination diet, we'll come back to stress. So you
okay.
mentioned the elimination diet, and could you talk a little bit about like what it is for patients? I mean, I think you kind of, or for our listeners, you talked a little bit about it, but what's the kind of like, okay, there's a bonus maybe for patients, but then what can be the downfall? What do you think about it? What's your thought process about that?
So I'm mixed, really. Like
Right.
way to say. But so a true elimination diet is, undertaken for like 21 to 30 days.
Hmm. Right.
Because the purpose is to identify foods that might be triggering symptoms.
Right.
After that amount of time, the idea is to reintroduce one at a time those foods that you took out in a controlled manner to see if they trigger symptoms.
Hmm.
Um, but what's missed in this whole process, again, is that food really isn't the root cause of the problem. So
Right.
we're talking about the increased gut permeability or leaky gut. And, when we've got those imbalances in the gut, like this is going to keep happening.
Hmm.
Um, and as well, we're getting the food particles, the food proteins into the bloodstream that are causing these types of reactions, but we're also getting those endotoxins from gut bugs. So,
Right.
so it might not even be food that's causing the reactions.
Hmm.
Um, so that said, and also again, our bodies run off of nutrients from foods we eat, so that's really important as well.
Hmm.
Body the body can't do everything it's supposed to do, let alone build and repair healthy skin if it doesn't have the fuel to do that.
Right. Totally. Can't run on nothing, no gas.
Exactly. And, and so I do think like if somebody wants to do a short-term elimination diet, again, like no longer than a month,
Hmm.
to see what the triggers are while you're working on addressing the root cause, like
Right.
it can help to take highly inflammatory foods out
Hmm.
um, in order to calm some of that inflammation, to start healing up the gut and to help manage symptoms. So it can be helpful for that. And that said though, like I find that, and a lot of people come to me with the IgG, the food sensitivity testing.
Hmm.
I don't typically recommend that because it's great if somebody has it done. It's just the functional testing. It's not inexpensive. And
Right.
so I like to focus on the stool test with people because that is a root cause situation, and resolving those issues is what I find in practice to be helpful to getting some resolution of what's happening on the skin, helping with out
Mm.
sensitivities and what have you. Whereas, identifying food sensitivities can help with symptoms, but that's not the root cause of the problem. The diet's going to keep getting smaller. So
Right.
what I typically recommend to people, like if they've had the food sensitivity test done, and the very low reactive ones, or even the moderate, not as important to keep out. You can keep out some of the higher, the highly reactive ones, that might
Hmm.
help. But then at the same time, I see people that have so many that it's just, the diet's going to be too restrictive.
Right.
So yeah, so in cases like that, there can be an additive effect. Eat more of a variety. The more we eat the same thing, the more likely we are to become sensitive to it. um but anyway, but so I think a short-term elimination diet to kind of help calm things down while you're working on the root cause can
Hmm.
be helpful and can help manage symptoms. But other than that, an elimination diet is not something that I recommend, and certainly not something to stay on for months at a time or longer.
Right. Yeah, totally agree. Yeah, I usually, where I see the most benefit for patients is when they've been on a standard American diet for a long period of time, and they're having a lot of systemic inflammation, which is causing a variety of problems, and then they feel amazing when they eliminate those standard things, like you were talking about, the standard food allergens. They feel like a new person. But for someone that like you said, when they've already eliminated so many foods from their diet and then they go into the elimination diet, it kind of like rips them of all the nutrients, and their vitality, which I think is part of such a key part of the healing process, is having that ignition of the vitality.
Absolutely, absolutely.
Okay, so we talked a little bit about, let's go back to the stress. So I'd love for you to talk about stress, because especially I know people had a lot of different changes in 2020, and we're moving into a new year of hopefully less stress. Did you see, one, like how does stress affect the gut and skin conditions? And then two, did you see a lot of different changes in your patient and client population with in regards to stress and affecting how it affected the gut microbiome and gut skin conditions?
Well, short answer to the second part of that, yes.
Yes.
Yeah. One client that, as soon as you said that, just came to mind really quickly. I spoke with her last week, adult psoriasis, and she has had major, like, things are going in the right direction. We're working on her gut. Her rashes have been better than they had been in like 20 years. And she started flaring like a few months ago. And
Mm-hmm.
we, met for a follow-up session last week. And it turns out, so, what's going on? So we go through the list of things, what's happening. Stress. She was
Mm-hmm.
having some stressful family situations.
Mm-hmm.
And she's like, I have been so stressed out. And there you go.
Mm.
So
Yeah.
I have seen that quite a bit in a variety of clients. So stress can be a main trigger. And so when we're talking about stress, it's really like chronic stress that is the problem. And most of us nowadays have chronic stress, which is stress that just doesn't stop.
Mm-hmm.
It's back in prehistoric days. Like we have our fight or flight response. Like we either need to fight the tiger or run away from it. But then as soon as the incident is over, your body's supposed to go back to normal, because those changes, they get you ready to fight or flee, um, cause all types of different chemical changes, like with the immune system, hormones, all of that in the body. And so short term, that's what we want. It prepares us to do what we need to do. But long term, it can cause significant dysfunction. And
Mm-hmm.
chronic stress can really come from, it can be physical. So like restricted diets are a form of stress, overexercise, injury, having some type of illness or condition like skin rashes or allergies. All of this is like a physical assault on the body. A stress
Mm-hmm.
can also be chemical. So it can come from any prescription medications we might be taking, or environmental pollutants, or other toxic exposures, like maybe there's mold in the house, or processed foods,
Mm-hmm.
junk and processed foods. And it can also be emotional. So, like personal, relationship, financial, work related concerns. So, and even though like your child might not be stressed out about work or finances, but they can feel your stress as an adult.
Totally.
And so, yeah. And so chronic stress can come from a combination of these different factors, and it wrecks the skin barrier, and it
Mm-hmm.
changes the way your immune system works. And that can lead to allergic responses. And, all of these, like the skin barrier dysfunction, how the immune system works, and allergic responses are all major problems in people with skin rashes. So stress absolutely can be a triggering cause for what's happening with the skin.
Yeah. Oh, that's great. Yeah. So key. And so when you're working with, when you discover a patient has or client is having the stresses be the trigger, what kind of things do you work on in regards to that? Do you do more mindfulness or, what's the kind of because it's still gut restoration, but I guess it has another key component mixed in with it.
It is. And, it's, this is one of those areas where stress management is not my superpower. So I always
It's not.
not my superpower. I'm very type A. And so I let clients know this. I'm like, okay, we're going to talk about stress management. Feel a little silly telling you about this, but one of the things that were some of the things that I find, and I do have a list of recommendations. It's actually on my website. If people, I know we're going to give my website. I have stress management and mindfulness tips.
Oh, great.
Yeah, something that I find most helpful for me as somebody who has a hard time relaxing, as well as for my clients that are very similar, and a lot
Hmm.
of autoimmune stuff have kind of these, types of personalities where, heightened stress responses,
Right.
is really that mindfulness piece. And for example, of course, meditation, all of these things, breathing. I struggle with doing that. So for me, mindfulness is helpful. And it can be something simple as, when I walk my dog and my mind is going places I don't want it to, I'm trying to relax. I listen, how many sounds can I hear? I hear traffic
Mm.
going by, I hear her collar jingling, I hear the wind in the trees. And so mindfulness is you can use it for focusing on things that are like really in the present so that you can be there. And even
Hmm.
sometimes it's like, how many different colors do I see? The trees are green, the grass is green, the cement is gray. So I find some of those mindful tips to be really helpful. Of course, meditation is great if whoever's listening is somebody that can do that. And there's so many apps available that can help with that now.
Yeah.
Uh, and then journaling, I think, is a great exercise, just sitting
Hmm.
kind of free form writing what comes out. Also there are motivational people, online, like, Tony Robbins type of people.
Hmm.
And sometimes, reading those types of things and positive quotes can be helpful as well. And then also
Yeah.
taking a walk and, doing whatever it is that, you find relaxing.
Right. Yeah, I think that's great because it is individualized, I think mindfulness, and it can be a great way to work with chronic health conditions addressing the mindfulness component, which is usually an underlying aspect of stress. Like you said, most of us are in some form of chronic stress, especially for type A, like myself, the Renaissance woman doing a billion things. Okay, let's talk about antibiotics because I think that's a fascinating aspect for us to talk about the gut, especially when it comes to children. So can you talk about how antibiotics are, one, changing the gut microbiome? And I'd love for us to just kind of dive deep into like, well, what happens? There's lots of different studies now. I've even read one recently that said that it can affect your microbiome for like 6 years when you take antibiotics. So, just talking about that too. And then we'll kind of dive deep into how probiotics can then help counteract the reaction of the antibiotics in regards to skin conditions.
Sure. So antibiotic use, I mean, obviously antibiotics kill off bacteria. So they're going to kill off
Mhm.
different kinds of bacteria. And so I have seen in a number of little, and not, not everybody's been exposed to antibiotics, but
Right.
a lot of those that have been exposed to antibiotics. And I have seen this in ones that were exposed in utero or,
Mhm.
during labor, or, mom was on antibiotics and the baby was breastfed. So the baby might not have directly even taken antibiotics.
Mhm.
But one of the associations between, so antibiotics kill off, good stuff in the gut. And when we don't have good stuff in the gut, that can allow stuff that's not so good to overgrow. And a major association that I see with antibiotic use is colonization of the gut with C. diff.
Mm.
And so C. diff is one of those things that we really don't want in there. And, in high levels, like from a conventional medicine standpoint, if it's high there, I mean, like you can be really sick.
Yeah.
When we're talking about looking at it from a functional perspective, I do see this on a lot of stool tests in babies that have had some antibiotic exposure and in some that haven't had antibiotic exposure. But the type of functional test, the functional stool test, is a lot more sensitive. So it's looking for like DNA from the bugs that make those
Mm.
toxins. So
Right.
I can explain that to parents so it's not super scary when they see results. It's like, oh my God.
Right.
Yeah.
What's happening?
Right. And it's like these are lower levels than you see conventionally. And I've had some parents like take the stool testing to their conventional doctor, do conventional testing, and it comes out clean.
Right.
So yeah, so I like to, so people don't get scared.
Right.
But
That's a good caveat.
yeah, that caveat. But like, so, and with the C. diff colonization, again, it is commonly associated with antibiotic use, and it can cause inflammation. It can cause rash and allergy symptoms. And there, I'll quote some research on this one because there were some interesting studies that in one study, so researchers looked at 65 infants who were between 1 to 12 months old with C. diff. And then 12 of them developed asthma, 6 developed eczema, and 3 developed food allergies by the time they were between the ages 2 to 5. So
Wow, that's amazing.
yeah, so there really is an association with C. diff colonization and the development of allergic disease. And then C. diff colonization can be caused by antibiotic use.
Mm.
I had one client who we had worked together for over a year. It was one of my longer cases. This poor little girl, she had a staph infection like on her fingers. So she already had some skin dysfunction. And so it was a staph infection on her finger. She took antibiotics for it. And the parents said it was literally like they gave her the antibiotics the first day. The next morning she woke up covered in eczema and it never didn't
Oh,
go.
poor
And they were
thing.
years. And so they found me. We did the testing. She had very high levels of C. diff toxin. And so, it was like, Mom, you probably called this one. Like, we can't, this is not a diagnosis or anything like that. And we can't say that this is the cause, but like,
Right.
noticed it right after the antibiotic use. So I have seen that in a lot of little ones. Yeah,
Mhm.
conditions. Mhm.
Yeah, that totally makes sense that when the gut is ripped from all of the healthy bacteria, you're going to see sometimes an immediate reaction, like you said. That's such an interesting case. And so, how do prebiotics and probiotics then help to repopulate the gut? And what's your main recommendation? Is there like a specific probiotic that you recommend to patients suffering specifically from eczema?
So yeah, so probiotics are strains of good bugs that
Mhm.
get introduced into the gut.
Right.
So like the most common probiotics that we get over the counter, just at the store, are bacterial based, and they're usually like lactobacillus and bifidobacterium. Those are like the two main strains.
Hmm.
And I I actually prefer using spore-based probiotics. So
Hmm.
there is quite a bit of research that's been done on probiotics and different skin conditions. In particular, there's quite a bit of research, or at least a handful of studies that I've found on for eczema, for example, lactobacillus rhamnosus in
Hmm. Hmm.
particular. They've found that one, if they supplement mom during pregnancy, that might lower the chances of baby developing eczema for like the first 11 years of life, uh,
Mm.
as well as their development of other atopic conditions later. So there have been some studies on that one. I've tried various probiotics, in practice, and it's
Hmm.
always different, right? Like what
Right.
the research, like, and what happens in somebody's body, like, is very different than the
Right.
research.
We're all individualized.
Visualize, yes, absolutely. So, what I typically like to use for folks is a spore-based probiotic.
Hmm.
So, and the reason for that, and especially with little kids. Like, again, like we don't exactly know what the makeup of a gut microbiome is supposed to be for somebody under 2 years old, for example. So,
Right.
and so for that purpose, and then for just, anybody, like if I see higher levels of bacteria, on a stool test, I don't really want to add more bacteria. I want to help the good stuff grow.
Yeah.
So even probiotics aren't necessarily benign. So I really like spore-based probiotics because they're not introducing like particular bacterial strains. They're like seeding the gut and helping the good stuff grow.
Right.
The reason why I don't particularly like those multi-bacterial strains with skin rashes is because bacteria from our gut, as well as in a lot of probiotic supplements, actually produce and or release histamine, which is a problem when we have allergies and itchiness and rashes and all of that. So
Mm-hmm.
depending on the probiotic, it can actually make things worse.
Right.
Um, so I'm pretty specific with probiotics. The other one that I find really helpful is an S. boulardii.
Mm.
So I typically find that I use like a something spore based, and or sometimes I'll do it in conjunction with an S. boulardii. S. boulardii is a non-pathogenic yeast-based probiotic.
Mm-hmm.
I like that for people, for example, that have like levels of H. pylori that we see in the stool test.
Mm-hmm.
It can reduce that. It can reduce levels of blasto hominis, which is a
Mm-hmm.
certain parasite that's pretty hard to get rid of.
Yeah.
It also can help lower levels of Clostridia if those are high, and it supports gut immune function. So there's some
Mm-hmm.
reasons for S. boulardii as well. Um, but with that, I'm also a little bit cautious. Like if somebody leans towards constipation, S. boulardii might not be the right one, because one of the most common things it's used for is antibiotic associated diarrhea. So like
Mm.
antibiotics give you some, loose stool, and S. boulardii can help with that. But yeah, so there are a lot of different probiotics out there.
Totally.
Yeah, and then so generally those are the two that I use most often. But then, everybody's different. Like I
Right.
do have a little one in particular that I'm thinking of right now that did have, like, she was older than 2 and had low levels of good stuff in her gut,
Mm-hmm.
in particular, like her bifido levels were low. So I'm like, you know what, she does need a bacterial strain. So
Yeah.
this is where everybody's different, and it is important even for probiotics to see what's happening in there. For prebiotics, so prebiotics feed the good gut bugs. So those are, like we talked about, the dietary fiber prebiotic foods that
Mm-hmm.
feed the good gut bugs to make the short chain fatty acids. So
Right.
prebiotics are really important. And I will, I don't give those to everybody. Pretty much everybody will have some sort of probiotic, but then
Mm-hmm.
probiotics I only do if I see low gut bugs on a stool test. Because
Right.
again, like I don't want to overfeed something if
Yeah.
there's already too much in there. Yeah.
Right. Yeah. It's like overpopulation. Not good. Nobody wants overpopulation. Right. Okay, that's great. Yeah. And so it sounds like that the key to choosing a probiotic is to work with a good practitioner who knows what probiotics, which is what I tell my patients too. Don't go randomly choosing a probiotic off the shelf. Let me guide you to what probiotic is best for you. Individualized medicine is key in functional medicine.
Yes. And that's what helps people get results.
That's great. So I think that's a great segue into talking about. So, why do you think that so many people are having a hard time treating chronic health conditions in patients, especially in the conventional model?
So that's a good question. I mean, I think that conventionally we don't connect the dots, right? So if
Mm,
you're taking a functional health approach, we're looking at how symptoms are tied to systems, and all systems in the body are connected. And really, skin problems, allergies, like we've been talking about, are really no exception. And they are a good example, though, of how we fail to look deeper for those root causes. Uh,
right.
because anybody that's been struggling with eczema or allergies, from a conventional, and has taken a conventional approach, I mean, it's like you're prescribed steroid creams and
Hmm.
Vaseline all over and wet wrap your kids, and all of
Right.
these things can be helpful for symptom management, but they're not addressing the root cause of the problem.
Right. Then it just comes back like a like a vengeance sometimes.
Exactly. And and it's when you leave the root cause just unaddressed,
Mm,
other problems down the line.
right.
And and you I mean, steroid medications, we can mention that they're there for a reason. Like, they
Right.
can help you get over the hump if you need to use them. So your kiddo, you do not have to struggle. That's what these things are there for. But we can't rely on them to solve the problem. And then, of
Yeah.
course, long-term use, and not sometimes not even that long-term use of steroid creams, can result in topical steroid withdrawal, which is even worse than the rashes themselves.
Totally.
So
Right.
yeah, so it really is important to look for that root cause. But yeah, and I think that's what we miss conventionally, is that we're not looking for the root cause. We're focusing on symptom management.
Right. Yeah, which is great. We need to be able to look at the root cause. And I think you hit it right on the nail on the head. It's like if the conventional model kind of like misses out that they're just addressing the symptoms, which as we know doesn't can make things worse. It just suppresses the root cause further and further down the line.
Yes.
So you mentioned steroids, and they are useful for certain situations. Like I myself had when I think I was in my 20s, I was climbing up a tree and to get my cat, and I scratched my leg, and there was poison oak on the tree, and it went like systemic. Like within like an hour, I had full blown like poison oak ivy all over myself. So I had to get a corticosteroid shot, and of course, I needed it. Like it was, and but it was just one time use. So there are emergency situations for sure.
Well, absolutely. And that's the other thing too. Like, I grew up with constant strep throat, constant ear infections. I've had so many surgeries for random things. Like, I have been, I am like the poster child for impaired gut health. But antibiotics, they can be life saving. Steroid creams, they help
Right.
manage symptoms. I even tell parents too, like, if your kiddo isn't sleeping because they're itchy or uncomfortable, like, not sleeping is a form of stress, which can make things worse. So,
Yeah.
on those really bad nights, use a Benadryl if it helps.
Mhm.
That's what those things are for. They're there to help, and the little ones don't have to suffer. We don't have to suffer with symptoms.
Right. Yeah, which is key in that higher, we call it naturopathic medicine, the higher therapeutic order. Of course, we want to help someone who's in this crazy state, so to speak, of ill health. And so, because your body's not going to be able to heal, like you said, the stress is so high. How can you address the root cause if the body can't even get out of being stressed?
Mhm.
One thing about the steroids, is there something that you recommend that in as an alternative for steroid use topically? Because I think that's a big place where people go to. Even my patients, when come to me with chronic skin conditions and they've been using the steroid, and that's the only thing that helps. What do you use with your clients?
Well, everybody's different. And so some of my, I would say for itch, one of my current favorite recommendations is like zinc, or even just zinc oxide cream.
Mm-hmm.
That can be really helpful. The other things for itch, soothing baths.
Mm,
A lot of people find these helpful, like gluten-free oats,
right.
uh, rice starch bath, even apple cider vinegar, all diluted. I have on my website too, under the skin section, like topical ideas. So these are listed there.
Oh,
So,
great. Okay.
and like how to do them is listed. And then it kind of depends, for moisture, it is really challenging with eczema type skin, with broken skin barrier. One of my favorite moisturizers is shea butter. um,
Mm-hmm.
it's very thick, it's very moisturizing, but if there's a nut allergy, there might be problems with shea butter. Something at cocoa butter is another thicker one that can be
Mm-hmm.
moisturizing. Emu oil is a good one. That's also thicker. For something like a little bit lighter, that's very hydrating. Omega-6 fatty acid oils
Mm-hmm.
are
Mm-hmm.
hydrating because the structure of the fatty acids like actually can penetrate the skin. So those
Right.
are things like sunflower seed oil, jojoba, hemp or rosehip oil. And
Mm-hmm.
then, and I let people know too, like, if those things aren't working, Eucerin, for example, has a great eczema relief hand cream that, I use personally when my hands get super, because I got some on a little bit on my finger.
Yeah.
So there are plenty of things out there. And also for itch, that seems to be obviously a big concern because it's very uncomfortable. But things for that, in addition to the zinc cream, like even dabbing on, like put a little apple cider vinegar on a cotton ball. I wouldn't
Hmm.
do that on open skin because it'll burn. But you can
Right.
also, you can also dilute it and do a diluted version of that and apply that to the skin. Um, Add some water to some like gluten-free oats, and see, this is where like I'm specifying gluten-free.
Right. Yeah. You don't want to use gluten if you're having that allergy for sure.
But if you're somebody who can do oats, you can make a paste like with
Yeah.
the oats and water and just put that over the skin. That can be very soothing also. And I do
Nice.
have too, actually, the guide to beat your little one's eczema. I know we're gonna add some resources for people,
Yeah.
so we could put these there as well.
Okay, great. Yeah. Oh, wonderful. Thank you for those amazing skin tips, because I think that's key, to have all this information about what the root cause is. But a lot of times we just need, like, I need the help. Like, what can I do right away? Which I hear from patients all the time. Emergency email, like, my skin is erupting. What can I do?
Oh my God, I know. It's just, I always feel so bad. I get the concerned parents at, all different times about, they're not sleeping, we're not sleeping, nobody's
Mm,
sleeping, everybody's
right.
uncomfortable, she's flaring. It's like,
Yeah.
it's scary for parents, and it's
And
very,
yeah, especially on the skin, I think too, because it's something visual, it can be a lot scarier for children and for the parents. Because, when it's inside, we don't see it as much. So we know it's there, but maybe it doesn't have the same reaction. But when it's on the skin, it's like, and it can be a barrier for children and for adults for their self image, right? If you're doing different activities and things like that.
absolutely. And that's one of the things I think that for me is such a motivator to do what I do, is that, I mean, growing up is hard enough as it is. I mean,
Right.
growing up is really hard. And, to have to deal with feeling different at the same time can be devastating for children.
Hmm.
And so, one of my goals is, and I had things growing up where, I felt different and bullied and all of that. So,
Hmm.
so I want to help other people through that. And it would be lovely if we can get all of these kiddos so young that they don't even remember that they had an issue. They remember none of it. Wouldn't that
Right.
be wonderful?
Right. Yeah. Ding. Like, it's just gone from their memory. They move on. Yeah. We can hope that for all of them for sure. Okay, Jennifer, one last fun question before we wrapped up today, and then we'll give the listener some great ways to find out about you as well. So, if you had an unlimited budget right now, what would you do to have the biggest impact on the health and welfare of the planet?
Oh my gosh, that's a really good question. I want it. The first thing that came to mind, I'm like, I would do a stool test on everyone.
That would be awesome. It like comes in the mail, like ding. Just like that would be great. That would give a lot of people good information for sure.
I think though, if if we could just help everybody understand the importance of eating a diet of whole real foods,
Mm,
and and it really, like, it not to deal with weight management or anything like that, or physical, whatever the body looks like, but just for overall health. Just making sure the body's nourished. Like, let's get the right stuff in so that the body can do what it's supposed to do, because the body's built to heal itself. We just have to get rid of the what's ever in the way preventing it from doing that, and give it the resources it needs to do that.
hmm.
Get nourished. Make sure your gut health is in shape as much as you possibly can, and manage stress. I mean, I think those are like the top three things, and in today's world, I think those are all really big challenges.
Yeah, that's great. Yeah, maybe you have a a little kit that comes in the mail to everybody, right? Yeah, like here's your key to stool testing, better health, optimal nutrition. Here you go. Love it. Okay, Jennifer. So, a couple things. You have some great freebies for our listeners, which I'll put in the show notes. So, your first of all, your website is Jennifer Karen Brand. That's correct. www.jenniferkarenbrand.com. And you have two freebies. One is a guide to beat your little one's eczema, and then also a guide to probiotics for skin rashes. Wonderful, which we hit on those topics today. So, those will give our listeners some more info.
Mhm.
And
Great.
what's the best way for one for our listeners to contact you to make an appointment for better skin health, and then also to learn about what you're doing following you? What are those two key things there?
So, so my website, so jenniferkarenbrand.com, and Karen is actually spelled funny, but if you type it in the normal way, it'll come to me also.
Okay.
Caryn, which is my middle name, or if you just do Karen, Jennifer Karen Brand, that'll pop up too. So the best way to get in touch with me, you can contact me through my website. There's a contact page. If you're ready to book an appointment, there's a book now button. So there's a questionnaire for children and one for adults. So you can set up and schedule and all of that there on my website. And then I do most of my social, actually pretty much all of my social media outreach and education, and provide resources and all of these fun tips and all this stuff that I talk about on Instagram,
Yay.
where I'm Jennifer Karen Brand. So it's JenniferKarenBrand.
Great. That's easy to find. And I'll link that to the show notes as well. So all the listeners will be able to locate you super easy, which is great. Well, thank you, Jennifer. It's been such a joy to have you on the show today. And I learned so much about food allergies and gut health and eczema. And I can't wait for our listeners to find out as well.
Me too. Thank you so much for having me. This was awesome.